Hi, my name is Kate Barnes, and this is my individual presentation, namely Assessment 1 Research Proposal. The main issue that will be addressed by this research project is what are parents' perceptions of the helpfulness of depression treatment options for adolescents, and does Facebook use influence these perceptions? The depression treatment options used will be medication, cognitive behavior therapy, and exercise. Social media will be Facebook, and adolescents will be aged between 12 and 25 years. The research project will be designed to explore how parents perceive the helpfulness of different treatment options for adolescents with depression, while trying to gain more insight into parents' understanding of and the barriers to help seeking help or help seeking. Try and answer questions like, do parents see medication or CBD as being more helpful, or do parents see exercise as being a helpful treatment option, and those types of things. Significant literature exists exploring depression, its causes and impacts on adults. Less is known about the etiology of adolescent depression, which is often a precursor to adult depression. It is reported that most adults experience their first symptoms before the age of 24 years. There's also been extensive exploration of risk factors for depression across a lifespan, socioeconomic, genetic factors, health conditions, including stress, life events, to try and sort of pinpoint what causes adolescents and adults to get depression. Depression is reported to be a highly prevalent mental health condition in adolescents, and 1 in 7 Australians will experience depression in their lifetime. Interestingly, the leading cause of death is suicide for adolescents in Australia, which is accounting for 2 out of 5 deaths for 15 to 17-year-olds, 1 out of 3 deaths for 18 to 24-year-olds, which is a 25% rise in the last decade. Research and efforts to increase adolescents' knowledge about depression or mental health literacy appears to be occurring successfully, and adolescents appear to be beginning to have superficial knowledge about depression, but lack of knowledge about treatment and symptom identification. It's thought that young people are less likely than any other age group to seek professional help. Only 31% of young women and 13% of young men with mental health problems had sought any professional help. And it's also reported that on top of this, we tend to underuse mental health service professionals, preferring support informally from parents. I guess what it is we know about young people and their health-seeking behaviours, like the barriers such as stigma and these sorts of things have received extensive research and attention, but we don't know about parents. But we also do know that parents, it's widely acknowledged that young people turn to parents and caregivers and friends for support. So it's imperative that they understand the depression treatment options available for adolescents in their care. So that leaves a few gaps. What are parents' help-seeking behaviours and their perceptions on how to help their adolescents address depression, especially when they're a primary resource for adolescents? And does parents' Facebook usage correlate with better perceptions of depression options for adolescents? The rationale for this study is to help understand the barriers to seeking treatment, to help understand the parents' perceptions to treatment options available for depression in adolescents, to increase understanding and perceptions of treatment of depression for parents and adolescents, and to understand the influence that Facebook has on these perceptions, whether positive, negative. Depression is treatable, and with management has a positive prognosis. Therefore, potential to increase the connections to professionals for parents would be a really important step to being able to get down the impact and the prevalence of depression. And it gives us ability to tap into a resource that's already in use, which is our parents, and hopefully then we'll stop preventable deaths by suicide in adolescents. Therefore, what are the research questions? What are parents' perceptions of depression treatment options for adolescents, and does Facebook influence positively towards these perceptions? This will be a quantitative correlation research which will attempt to determine the extent of a relationship of identified variables using statistical data. The sample will be parents of adolescents aged between 12 and 25 years as users of Facebook. Given the limited time frame, a program called Cloud Research will be used to recruit and conduct the research. The criteria will be included in the selection process on Cloud Research. The measures will include a vignette sliding scale of identifiable treatment options and also a social media survey. Some of the ethical considerations will be informed consent, voluntary participation, which includes, there'll be informed consent and things to go in on the survey when you're going and agreeing to being part of the research. There will be counselling and services available in case this triggers or has a negative effect on a person, and it will be confidential and anonymous if deemed to be. The significance, prevention or a milder onset of depression from adolescence to adulthood, education, parents to support adolescents, increase capacity of resources, time targeted, and hopefully decrease suicide rates for adolescents. Thank you.